It's highlighted that it's recording, but
mine doesn't. But there you go. That's fine. So welcome everybody.
There we go.
And a very happy New Year. So kicking us off, are there any declarations of interest? Oh, anyone on call first of all? No one on call. Great. Any declarations of interest relating to items on the agenda? Okay, so we move straight into the minutes of the last meeting from the 3rd of November. Any comments, or is everyone happy with those? Were there some coming through from Emma? Emma.
Hi, Andrew. It was just to raise, I've sent a couple of comments over to Hayley for the minutes. It was just some of the wording within the section on the terms of reference, particularly in reference to Amar being a member of the committee. It was to say that the clinical representative would be a governing body member, but obviously isn't part of the membership. They're in attendance for the meeting, so it's just to make sure that was amended, and also in the present section on the minutes that Amar was also moved into the in attendance rather than the membership section, please, if possible.
Okay, so noted. Any other comments on the minutes? Okay, so with those amendments, we're happy to approve, and we move on to actions. No actions to update from that meeting. Chair's update, nothing other than to reflect on the latest lockdown. I'm imagining we're going to hear a lot about vaccinations and the current situation today, but obviously I'm very mindful of the workload that people are under at the moment, so we'll try and whiz through, but obviously giving due diligence wherever we can. Kieran.
I think there was an action for me, unless I've got it into the wrong section, but I think it was in the public section around positive primary care comms. So just to update, I've spoken with Jo, and she's really happy for what she produced to be shared more widely. They do need updating because they're originally produced a couple of months ago. So I've agreed with Jo that I'll update those, share them again with Jo and Jonathan Cox, if that's okay, Jonathan, at the same time as sharing it with comms. So we have both the primary care perspective and the sort of the more patient-facing, friendly worded perspective as well. So that's the update as it stands. So I'll take those actions away to work with Jonathan, Jo and comms to produce, I suppose, two corresponding sets of communication.
And thank you for correcting me, because I had the wrong action log in front of me, which was the private action log. So you pulled me back on track. So thank you, Kieran. Okay, so moving swiftly along then. So the mass vaccination programme, Julie Lemmy, I'm not sure, is she with us yet? Do we need to wait for her to give that update, Julie? So if we move on to the internal audit, Julie Curtis, some really good news as far as I'm concerned.
Yes, and me. Thank you very much, Andrew. So just to bring to the committee's attention that the internal audit that was looking at auditing both the primary care commissioning committee and also delegated commissioning has rated as with a substantial assurance, which is very good news. And I think, considering that we haven't had delegation for a year yet, that is really testament to the team and also the membership of the group. So I would like to thank everybody for that. There are two management actions which are low priority, just to bring to the attention of the committee, and that is making sure that in our notes and our minutes and our actions that there is a clear distinction between decision making and also then actions to be taken. I think we're reasonably good at that, actually. So we'll just need to review how we might just capture that, maybe just exactly the decisions that are being made within the committee. Hayley, did you want to come on that point? I can't hear you.
Sorry, I was just saying, with the actions, I think the papers they asked for, it was for committee meetings where there wasn't any action, so there was no action log. So moving forward, what I've done is I've created an action log, but if there's no actions, I've put on the action log no action, so it's just quite clear.
Okay, perfect. Thank you very much. So I would say that action has been undertaken and done. And then the second is about a formal process for the review of rent and rate reimbursement as part of the primary care budget setting. And that is something that we will need to review as we go through January. So that I submit that to the committee to note. Thank you.
Bev.
Just very quickly, Chair, just to say congratulations. I know how difficult it is to get substantial assurance on an audit, and I know what hard work and rigour needs to go into that. So, really well done. Brilliant.
Thank you. And I can declare my conflict as being audit chair is no longer, because we have a new audit chair, hence not declaring it. So I can sit smugly in the meeting and reflect on the paper as a member of the audit committee rather than as audit chair. So well done, everyone. And as Bev says, it is by exception that we get these substantial assurance pieces. So really well done. Okay, Julie, I see you've joined us. I hope that's Julie at the bottom in my screen. So if you could give us an update on the mass vaccination programme, please, Julie.
Yeah. Okay. So I'm pleased and proud to report that out of our 16 designated PCN sites, they are all going to be live and will be have been and will be vaccinating patients this week. In terms of what they've done, I think it's an amazing piece of work. They have all stepped up unbelievably, and they've met. We've had to jump across numerous hurdles, and I have to say that the star of the day has to be Sanjay, who was running around Willowbrook last week, stabbing anything that moved. But no, joking aside, in terms of they have just gone and we have rolled, and I think we have formally gone out and said thank you to all the teams, but it's just been an amazing piece of work, and I'm very proud to be part of that, and what has been achieved in the few weeks. That said, we've still got an awful lot of hurdles to jump over, but we will do that. The latest update is obviously, clearly everyone will be aware that we've got the AstraZeneca vaccine, which is landing and has landed in practice PCN sites today, and will be landing for the rest of the week. They will. I've asked that they can be ring fenced so that we can commence our formal home visiting team to go out and do the care homes, and also we need to be doing the housebound patients as well. And I've had a really good conversation today with NHFT, who are going to come and support so that we can get our housebounds and our care homes fully vaccinated, because we do have a deadline date, but it's just, it will be amazing if we can pull that off. And I know we will pull that off because I have every confidence in the teams that are out there, but it's just about doing some coordination work. So amazing, and I can't thank everybody enough who's been involved and supported. And this county is a shining star in terms of other areas. I probably, the other regions, and I think that what we've managed to achieve is amazing. So I'll shut up. As you can see, I'm very proud.
Excellent. Thank you very much, Angela.
So
yeah. Thanks, Julie. And obviously, I know my team are heavily involved, especially with the care home work. I'm just asking, Julie, is there any feedback from the conversation I had with you earlier? I raised with Julie, we've got some dom care providers that are providing very intensive care for people, those who are being ventilated at home. I'm really worried that workforce, if we don't get them vaccinated, if they go down, those patients will be in ITU in our hospitals. So I'm just asking if there's any way we could prioritise that workforce as the housebound are getting vaccinated. Could we prioritise that workforce? Julie, did you get any joy today on that?
Yeah, that's why I was late. I was on another, well, it seems like another meeting, but I did raise it. They're currently pulling together a list of all of them, but they are on the list and they will be and obviously we will work through it. So yes, they're one of our they know that they're one of our highest priorities, along with our housebound and our care homes. So yeah, on it, Ange.
Thank you, darling. That's great.
Thank you. Beth, is your hand up again, or was that from before? Okay, any questions for Julie then? Julie.
Thank you, Andrew. This is not a question. This is also to thank Julie and the team for the amazing work and coordination that they have done and helping and supporting the PCN sites and the GP practices. I know that she and the team have been working really, really hard and lots of hours, and I just wanted to thank the amazing team that we've got as well. So thank you.
Excellent. Thank you. So well done to all. I think the first thing is to obviously on behalf of the committee to thank the team and the PCNs. I think we need to find a way of actually getting a formal communication out. You know, recognising its early days, but actually to get set up in this fashion needs to be recognised. And I think perhaps we should ask Joe to write out on behalf of the CCG and on behalf of the committee. I'm very happy to, but I think having it as a CCG wide would be very useful. And the second thing is just, are there any things that we can do to support further, or any things coming down the line that we need to have on our radar?
I think at the moment it's just, I think the biggest issue that we are currently all facing is not having the vaccine and knowing when we're going to have the vaccine. But I'm confident that over the next couple of weeks that vaccine will start coming in, and because what they're doing at the moment, Andrew, and the rest of the committee, is they're operating a push model, which means that obviously we get the vaccine when we get it, or we get the odd occasion where we're asked, has any PCN, can they, or do they want to take another pizza box of Pfizer? So, and to be fair, our PCNs have really stepped up and have taken that opportunity. I think that's the biggest issue, along with the normal. But you know, there are lots of things, but we are managing that through the cell, and obviously working with the PCN. So at the moment, there's nothing that I can see at the moment, unless Jonathan or Sanjay or anybody else wants to come in. It's just getting, I think everybody wants to just get on and vaccinate through those cohorts, but the vaccine is just not there. But that is not, it's not unique to this county. It's, you know, obviously throughout. So I think that's probably our issue at the moment. So I'll let my other colleagues come in and say.
Okay, well, Sanjay was first up with a hand, then Sharon, and then Amar.
Hi, happy New Year, everyone. I think Julie's covered it. The biggest issue is all the logistics and that, and but flexibility is probably an understatement in terms of how the PCNs have managed it. To take, you know, delivery with a day's notice and to set up clinics, and that is phenomenal, which I know some PCNs have actually done. I'm sure Jonathan's got more details on that. And to be honest, I've just had something flash across my screen, Julie, which is going to increase our numbers because they've changed the guidance for the 6th dose. We will now be able to up our numbers from one pizza box from 975 by about 195 extra, I think. So that is great news in terms of if you spread that across all 16 PCNs, we're suddenly going to be having, I can't do maths, Julie knows.
Yeah. That's amazing news. Really happy with that, because I think that was one of our, but yeah, that's fantastic news. So brilliant. That means we can get more of the next cohorts and everything, and more new patients vaccinated more quickly. So that's brilliant news.
The other bit I was going to say was, I think the PCNs would certainly appreciate, you know, that acknowledgement from the committee. I think they'd probably appreciate it, even something going out a bit wider to say that we are doing this, because I live in Leicestershire and there is nothing like this going on here at the moment to this scale. So there is a marked difference, and so I think primary care and PCNs get a hammering a lot of the time from the public, and we've seen it in the space of 9 months. We've gone from hero to zero. And I think something like this needs to be put out there, just so they can see that we're not all closed. Thank you. That was it.
Sharon.
Some good news from a call I was on just prior to this is that the designated sites will all be asked to sign up to Inform, which will then enable them to be ordering vaccines. So it won't be a push model, they'll be able to pull. So actually they'll be able to pre-order all of their vaccine and consumables, so that they'll be able to run at a rate that they want to run at. So I think that's really good news that coming online within the next few days. So I think that will be good.
Great, thank you. Emma.
Well, first of all, Happy New Year to everybody, and apologies for being slightly tardy. I mean, firstly, yes, I think like everybody's echoed, I think a big thank you to all the team, particularly Julie's hard work and the PCNs in terms of delivering it. I know Sanjay at our practice has been working very hard in implementing it, and just like other practice colleagues have other in our locality actually. I think just wanted to pick up on one point, Julie, that came across from some colleagues when I was speaking to them at locality around Christmas, was about the IT issues. Whether I know with System 1 we've been using in our practice and we've been sort of, not having too many difficulties, I think. But with EMIS, have there been any issues at all, or have generally people been okay with that? Or I know Chris obviously he's been giving me some advice, but I just thought I'd ask if you had any feedback at all.
Yeah, thanks, Alma. We have obviously got a mixed economy in some sites, but we've been able, and I have to say, our NEL IT team have just gone out and, like the rest of us, like Kieran in it, and Tracy, Hayley, all of the rest of it, everybody's just stepped up. So we've overcome every single issue so far that we've had, but there are no issues because they've been provided with kit and they can access both. So I think it was one of the queries that we managed to get resolved, and that's really we've got one of the sites this week that are going, which is both. So yeah, but it's been fantastic. So I think it's a combined team effort.
Great, thank you. Jonathan.
Yes, and Happy New Year to everyone, and to echo the thanks for Julie and her team. I've said this a couple of times now, and it doesn't get old repeating it. In terms of the IT, just to pick up, Amar, on your question, there's been no IT issues in respect of the bailiwick of the CCG, but there has been an issue with EMIS. In that System 1, the makers of System 1 have quickly got their act together and got the coding bit of replies from the central Pinnacle system into the GP clinical system all beautifully coded. EMIS has been a bit slack and hasn't got that sorted out. This is not within our power to alter. It's just to be aware. EMIS is usually very quick on these things, and I suspect they'll be a little bit embarrassed about this, and I think that will tidy itself up of its own accord. I also share Sanjay's smile that we are now properly got the 6th dose that people have been chatting about. It's now sort of properly official that we're allowed to use it. There's a few little tail end Charlie things that need to be tidied up with that. We need that to come onto a PGD rather than a PSD for those of you that are geeky minded about these pharmaceutical matters. And once that's in place, that'll make that a lot easier, and we can drag out the 1170 jabs from the 975 boxes. And the other good piece of news, which obviously we just heard, is that the system by which the vaccine alights in the practices is complex, but as we move over to the pull system by which practices, which has just been described in this committee, that will be a huge benefit, because then practices and PCNs and the sites can start going at their own pace, and they can risk laying on a few more clinics because they kind of know the stuff's arriving. At the moment there's a bit of a break because you don't quite know when it's coming, and it comes at the very last second, and then you've got 24 hours to make sure that everything's in order. So once that breaks, and this is natural because of course it's totally expected that you need to push these things for a start and then go over to an ordering system later. So broadly it's going rather well, it seems, in Northamptonshire, which is, I think, down to an enormous amount of hard work, in fact, from top to bottom, and we've just got to keep going now. Really, we're almost into the marathon phase now, so we've got to take a deep breath and keep running until June, July, August of next year, as slowly we drag down the cohorts. But for reports committee, I can confirm, yes, things are going quite well at the moment.
Great. Julie, did you have your hand up from previously? Oh. You were on mute, but I'm assuming that you didn't. Okay. So I like Jonathan's marathon analogy. I think it reminds us that there is probably a wall at some point to hit, but I think just applying the diligence that we have so far means we'll smash through that. So thank you for all the positive comments and all the hard work. I will take the action. I'll write to Joe and Toby this evening on behalf of the committee, recommending that we actually, positioning where we are, but also recommending that we actually put out some positive comms about the progress that has been made, and I'll copy Julie Curtin on that so that we've got a track to that. Okay, thank you. Any further comments? So we note the response, and bring us to other matters. We have Stuart with the finance update.
Thank you, Andrew. I'll keep this quite brief. I'll assume the paper is read. What we've got at month 8 is a 2.7 million underspend as we sit here today. That's made up of 2 bits. There is 696 within the delegated, which is mainly made up of what is commonly known as the R's, or the additional roles, because we've been given, in essence, 3.1 million of that up front to spend, and we are still underspending on that at this moment in time. To note, obviously we don't want to underspend that, so we do it. The other 2 million, the majority of that is prescribing, which is currently underspent by 1.1 million. And the other bit is the locally commissioned services, which is 848,000 underspent. But the primary care team are putting plans together to make sure that is spent by year end. And obviously prescribing tends to be what prescribing tends to be in reality. And we are always a few months behind, and we are expecting that obviously to creep up over the winter months. Although the impact of COVID does seem to throw the prescribing numbers quite a bit at the moment on a month-to-month basis. And I'll stop and take any questions.
Okay, any questions for Stuart? Stunned silence. I guess it's not a massive change to the position that we've been reporting all the way through, and is regularly reviewed by the Finance Committee as well. So if there are no further questions, we'll note and move on to the GMAST update. Julie. Oh, Julie Curtis. Sorry, Lemmy, even.
Apologies, I was just trying to get my screen to play ball with me, and it wasn't. Okay, so I will take the paper as read, and I think the update in terms of, I'm just trying to pull it up. Apologies, I'm a bit behind with lots of meetings today, but I'm happy to take any questions because I think it's fairly straightforward in terms of the update paper. Okay,
any questions? So swiftly, committee noting the paper and the update, and then we have item 9, which is the general practice forward view. Kieran.
Couple of areas of focus. I'll switch slightly the way I was going to present it, mainly following on Sanjay's point around the general beating up of primary care at times, and sort of something that hasn't gone unnoticed through the care navigation champions as well. And the long and the short of it is that an action was taken away to produce 2 radio adverts. Now, previous years we've produced a radio advert. I don't know if anyone would have listened to it at the time, but Darren just referring to care navigation and how different it is for patients and patients to persevere and sort of work to this. So Joe has reproduced that advert, but we also produced a second one again through Joe, which was around the new ways of working in primary care. And please be patient and understand and treat primary care with the respect it deserves. And they're both fantastic, to be honest. And I shall share a link for both of those recordings after the meeting. And this has really come from, something that's been fed back through the Champions Group throughout COVID. I think as that sort of clapping on a Thursday started to dissipate, it became a little bit more demanding, and expectations were maybe higher than actuality. And some of the previous discussions we've had here around how different things are operating at the moment, and I think if you recall some of the the number of telephone consultations and the amount of additional time a telephone consultation makes, all of this is extra burden. And I think in some areas this was manifesting in behaviours that aren't really appropriate, and so I think the action that's been taken is quite appropriate. I think hopefully it goes down well. We have also, as part of the care navigation workstream, put on additional training sessions for staff, and this is as much around resilience. So being able to manage sort of conflict management and managing difficult situations, which have gone down really well. So I think we did 4 of those in December, 1 in November. The uptake was incredible, phenomenal. And whether this is a byproduct of things being done virtually, but having been involved with some of these care navigation sessions, training sessions previously, not massively well attended at times, some better than others, but we're talking 20 attendees at all of these events, which is pretty significant, to be honest, in comparison to what we've had before. And as a result, we're putting additional sessions on as well throughout the year. So I think trying to respond and roll to some of these byproducts we're seeing, trying to facilitate some skills in primary care to better help, but at the same time maybe better manage expectations of patients as well at the same time. So I'll share those links after the meeting, because having listened to them, and I know we as a team have listened to them, I think they're absolutely hit the spot, to be honest, in terms of the way they are articulated. So I just wanted to switch that around. The other point really is around video consultation, and I realised that most of that conversation will take place in the private meeting, but realistically the update from last month was that we've taken forward the comments and the feedback from primary care, and that has now been turned into a proposal which is going to be discussed later on today with regards to I suppose what we'll call the medium term plan from a digital perspective, with one eye on a longer term system-wide digital plan as well, which may be bigger than just primary care, but leave that there if anyone has any questions.
Okay, any questions for Karen? Okay, thank you. So we note the update. Thank you, Karen. And finally, the sea of green that is the primary care quality report, Sharon.
Good afternoon, everybody. I will take the paper as read and take any questions. I think the only thing just to highlight in this element is that we have got new CQC inspectors in the patch now. They did change over the middle of over the summer months, and I'm working well with those and meeting with those on a monthly basis, and they have been going through the virtual inspections with minimal on-site interventions as part of the inspection process moving forward. So all of the practices that were in special measures have all received a some sort of visit. So things are looking good. Despite all of the other things that we've got going on, they're commenting and seeing good practice and innovative practice. So things from a CQC perspective are looking hopeful.
Great. Any questions, Julie?
It's more not a question, it's more of a comment really. When I was reading the papers, I can see that we've got 62 practices that are good or outstanding, and only 7 that either require improvement or inadequate. And I reminded myself in the primary care strategy that one of our ambitions is that all our practices are either good or outstanding in the next 3 years. Well, it'll be 2 years now because the strategy's a year old. So I am pleased that actually 62 are already in that place, and we just need therefore to keep supporting the 7, and hopefully with the new inspection regime, we stay with this really good practice that I think we're now starting to demonstrate across our practices in Northamptonshire.
Nods of approval. Excellent. Okay, so we note that there is no other business that I'm aware of, so we can formally close this meeting. Just to remind people that the next meeting will be at the beginning of March, because we're doing a bi-monthly approach to these meetings in the short term. So without further ado, we can stop the recording and move on to the private section of the meeting.